Okay, so we all know walking is probably one of the best forms of exercise, but today I want to discuss 5 challenges you can do to make your walking even better and more interesting.
Introducing the Perimena Bliss Podcast, a show dedicated to unraveling the mysteries of achieving optimal health naturally as you transition into perimenopause and menopause. Get ready to join your host, Dr. Seth Yates, an experienced naturopathic doctor, acupuncturist, and kinesiologist, as he shares his wealth of knowledge acquired from over 40,000 patient visits and 15 years in working with perimenopausal females. Welcome to the Perimena Bliss Podcast.
Hey, this is Doc Yates. Welcome to the PerimentalBliss.com podcast, brought to you by PerimentalBliss.com, ablehealth.us, and today I want to talk about walking, how you can walk yourself back into health. Okay, a lot of people when they're first kind of getting back into exercise, they prefer to use walking, and once you kind of get, walking down and you're looking for what's the next step, let's discuss a few. We're going to talk about 5 walking challenges that you can do to take your walks to the next level and get even more benefit out of it. Okay, let's just jump right into it today. So number 1, the telephone pole challenge. So if you live in a neighborhood or on a road where there's telephone poles, you will basically be like this. When you start walking, to get to the first pole, you just walk normally. But then once you reach that is the on switch, and then to get to the next pole, you're going to ramp things up, which means you could either power walk, you could jog, you could run until you get to the next pole. Once you get to the second pole, then you return back to your walking speed, and you just continue this. So it's a good way to kind of like ramp things up, get the muscles firing, and then you get a recovery time by doing a normal walking pace between every other pole. So try the every other pole telephone challenge for your next walk, and you'll definitely feel more muscles working than previously on your regular walking sessions. The next one is the soccer field challenge. So if you have a nice soccer field or a park in your area, walking around the soccer field is great because you can be walking on grass as opposed to on a hard pavement. But what I'm going to have you do is that every time you get to the long end of the field before you're walking down it, you're going to do 10 walking lunges and then continue walking. And now the difficulty of those lunges will depend upon how deep you're going. You could just be like a very shallow lunge, like a bigger step, or you could be doing a bigger lunge, taking your knee right down to the ground. So try the soccer field challenge out, do some lunges, get some increased mobility through your hips and strength through your glutes, and you will feel that difference. The third walking challenge is kind of more of an assessment. So next time you're walking and it's been after a rain, everything is dried up except there's the odd puddle left, assuming it's not too deep, walk just regular walking, go right through the puddle and just maintain walking how you always walk, right through the puddle, and then take at least another 10 strides past the puddle. Then stop and go back and take a look at your wet footprints. You can do the same thing if you're walking through the sand. The thing is, when you're walking through the sand, sometimes your stride's a little bit different because the way you're pushing off and slipping in the sand makes it harder to assess. So do the puddle challenge, and things you want to look for is one stride longer than the other. Like if you notice, are you stepping further with your right foot versus your left foot? Does one foot turn out more than the other one? Are you getting more kind of like water or more of a footprint shown on the outside versus the inside of your shoe, or vice versa compared to feet? So if you notice any of these things that are off, make sure next time if you're coming in for acupuncture or massage or osteopath, either at our clinic or another clinic, let them know about any of these imbalances that you found, and they can give you some tips to help straighten that out. Okay, the fourth challenge is the runway model challenge. So next time when you're walking, see if you can get a little bit more bounce in your step, like a runway model, to get your hair kind of get a little more bounce into it. And what you're going to have to do this, it means you're actually going to have to be pushing off through your foot and through the ball of your foot and through your big toe to get that. So I don't want you slamming down and landing hard. We want you to still land soft. But by getting that bounce, it means you're actually mobilizing your ankle and pushing off through your foot, so you're getting good strengthening through your feet. this is really important. The strength of your foot and the strength of your arch plays a big role for, lower body health. The next one, the cemetery challenge. So, next time when you're feeling stressed out, anxious, worried about something, go for your walk through the local cemetery. And as you're walking through, make notes about the different dates on the stones. You'll see people who've lived longer than you, people who've lived much shorter than you, people that live through harder times than we live through. And it will really be a good way to kind of help put things in perspective about, of the things that are stressing you out right now, what are the things that really matter? There's probably 75% of them will just be wiped out because you realize in the long game, they don't matter at all. So it'll help you put things in perspective, and if you're feeling stressed and you need to get outside, go for a walk, do the cemetery challenge. Okay, finally I'm just going to finish with some walking tips. 1, if you're always walking down, especially like a gravel road or a country road, and you're always walking, say, facing traffic, I would suggest walking facing traffic and then turn around and walk the other way on the same way back. The reason is that roads are graded and put on angles so that the water runs off. And if you're always walking on the same angle, that can affect your hips and knees. So if you walk on that angle, then you turn around and come right back on the same one, then you're at least switching the angle every time, so you're not always doing the same awkward angle for your knees and hips. The next one, move your arms. A lot of times people, like in that Seinfeld episode, it's like they just walk with their arms and they don't move them at all. You've got to move your arms, and enough that you're getting some rotation through your shoulder. When your right leg goes forward and your left arm and shoulder go forward, it's causing a slight twisting of the spine. And it's every step, it's this twisting, untwisting, untwisting. And that will help loosen your spine up and keep it loose. So you want to be nice and tall. Stand tall, don't lean forward. Nice and tall, but relaxed. So it's like instead of trying to reach up, just allow yourself to stand tall. Walk with your arms moving, and you'll get this rotation through your spine, and it's going to help loosen things up. So those are all of the tips and challenges for your next walk. Try them out. Let us know how it went. And I hope this was helpful. This is Doc Yates, signing off.
Thank you for tuning in to the Paramena Bliss podcast. Don't forget to hit the subscribe button and visit paramenobliss.com for more valuable information on how you can thrive during your transition through perimenopause. Join our community of like-minded women who are dedicated to achieving optimal health naturally, and stay up to date with the latest tips, tricks, and advice from Dr. Seth Yates. And we'll catch you on the next episode of the Paramena Bliss podcast.